Hi, everyone. This is Dr. Lauren Critchlow from Legacy Physical Therapy. I hope you all are having a lovely Thursday. Today's topic is something that's not usually talked about, especially when we go to the doctor, and a lot of women are suffering from this problem, and that is dyspareunia. And you're probably wondering, what the heck is that? So dyspareunia is a pretty common condition, and it's actually, in short form, it is pain with intercourse. But by definition, it's painful vaginal penetration, usually in the absence of a disease. It's usually a symptom. It can manifest as pain with intercourse, with initial or deep penetration. It can be dependent on the position, and it can occur after intercourse or even during orgasm. So the pain can be global, it could be diffuse, or it can be in a very specific area vaginally. So I kind of want to focus a little bit on the functional side of this condition, since this is something that we often treat as pelvic floor physical therapists. So I'm just going to start first with bringing in this lovely pelvic model that we all love to see. Just to orient you, here's the front of our pelvis. So this would be our pubic bone on the front. If I spin it around, we have our lumbar spine and our sacrum and our little tailbone on the back here. And then if I flip this guy under, this is the area that we are sitting on. So these two structures here are our two sit bones. So between all of that, you have the three layers of the pelvic floor muscles. I know we've talked about this in the past, but just so you can see it here, the three layers of the muscles, and it's skeletal muscle. So this is contractile tissue. It's just like your biceps or your quads. These muscles need to be able to contract or tighten, also known as what we call a kegel. And these muscles also need to be able to relax and be kind of in a normal resting position. And they also need to be able to bulge or lengthen. So when we go to the bathroom, for instance, have a bowel movement, we need to be able to lengthen here in order to get things out. So with intercourse, of course, these muscles need to be able to stretch. They need to be able to have some flexibility to them. And if they don't, or if there's a lot of rigidity and there's a lot of tightness, that can cause pain with intercourse. So functionally, what we often find in therapy is that these muscles are very, very rigid, and that is contributing to the patient's pain. So again, we talk more about the functional cause of dyspareunia or painful intercourse, and that's a result of pelvic floor muscle dysfunction, due to the muscles being overactive, or also known as hypertonic, not allowing for mobility or movement during intercourse. In some cases, it can be due to the muscles being very, very weak, because there's a decreased blood flow to the vaginal tissues. But we usually see that in conjunction with a decrease in estrogen levels. And a lot of times we might see that in our postmenopausal women that are lacking the lubrication that they used to have because of not having the estrogen. So it's a little bit different from the muscles, and sometimes that can cause the muscles to be really tight. But in that scenario, sometimes it's a situation where there's not a lot of estrogen, there's not a lot of blood flow, there's not a lot of lubrication, and that's causing irritation with intercourse. So pelvic floor dysfunction is just kind of this big term that we use that talks about the pelvic floor not being able to contract, relax, or bulge effectively, where in relation to bowel, bladder, or sexual dysfunctions, or even chronic pelvic pain. So let's kind of talk about some contributing factors to muscle dysfunction. And some of these things are more medically based, so there are some medical things that can contribute to or cause dysfunction in the muscles, which can then cause painful intercourse. Prior pelvic surgeries, childbirth injury or scarring. So a lot of times if there's a scar from delivery, that scar itself can be very, very painful. And that can cause a reaction in the muscles where everything goes on guard, okay? Low back pain can contribute to the muscles in the pelvic floor being tight. Any sexual injuries or pelvic infections, pelvic inflammation, sometimes postural dysfunction, so how we are standing, how we hold ourselves, that can contribute to tightening of the pelvic floor, habitual tightening of the pelvic floor. SI joint pain, that kind of goes along with back pain, falling on the buttocks or the tailbone, that shearing force, that injury can cause a reaction of the muscles to be very tight. Stress, so stress can definitely contribute to the muscles being overactive. Chronic holding patterns, so we often see this with women that have, if they're trying to prevent leaking or if there's a prolapse problem, they're constantly doing Kegels or they're constantly holding tension in their bellies or in their pelvic floor, and over time that makes the muscles tight as well. Chronic straining, so when we go to the bathroom, that can contribute. Hormonal change or menopause, like I mentioned, the muscles can get a little bit weak, and there can be dryness or friction due to decreased lubrication. Certain skin conditions as well, and there are also some medical conditions that I'm not going to get into too much depth on. There are other conditions like endometriosis and vaginismus that can contribute to pain as well, but that's for another time to talk about. So if any of this sounds familiar to you, be sure to contact your physician initially or contact a pelvic floor physical therapist or specialist to determine if this is a functional problem with the pelvic floor, because a lot of times that is what we see. So if anything I mentioned sounds like, hey, this is me, or yeah, I'm having this problem for sure, reach out to us or reach out to a pelvic floor specialist that can help guide you in the right direction.